Good afternoon. Welcome to the House Republican Policy Committee meeting and hearing here in your beautiful county. If you've enjoyed the trip out here. I'm Representative Kerry Bettinghoff. I'm out of Center and Mifflin counties, home of the Penn State Nittany Lions and bowl champions. Yeah, there you go.
We are.
Very good. I want to first of all take a moment to thank Matt Dowling for having us here as a new representative. I'm always pleased to see people who jump in feet first and with both feet and want to take on some issues. I was really somewhat taken aback when he came and talked to us specifically about wanting to look at this specifically from how it's affecting children and families and the extended family. And I think that's sadly a second generation of issues that we didn't necessarily talk about in our earlier hearings that we had last year as much. And so this is a good opportunity, and it's also a good reminder, as Matthew has said to me several times, that this is not limited to any part of our state, any particular age group, and he wanted to give a good rural representation of what's going on here, specifically in some of his agencies. So on behalf of the General Assembly and our Policy Committee, thank you, Matthew. I'm going to turn the microphone over to him, and then we'll get started.
Well, I just want to thank everyone for being here today. I notice we have our county commissioners represented, many of our human service agencies represented, and constituents from all walks of life are here, so I want to thank you. Today's hearing on the effects of opioid addiction on children and youth is what we really want to focus on. I spent probably 7 to 8 years in a nonprofit organization that provided youth services. I was with the Boy Scouts of America, and I got to see how children are served in a number of different ways. Unfortunately, we're now seeing the effects of opioid addiction and how that's relating to children. So I really wanted to have a conversation to kind of drill down and dissect this problem and to look at how children are being affected. Just as some housekeeping measures, and I'm going to get to introducing my colleagues in just a moment, but I want to let you know that the audio and video of today's hearing is being recorded by the House Republican Video Services and will be rebroadcast via WMBS 590 AM and 101 FM. It will also be on Fayette TV, on Atlantic Broadband Channel 77, and on the A channel on the Armstrong cable system. Archived footage from today's hearing, along with copies of the written testimony, will be made available at repdowling.com and via the House Republican Policy Committee site, pagoppolicy.com. Today's hearing of the House Majority Policy Committee, this committee works with other committees in the State House to advance policy that benefits the people of Pennsylvania. Through hearings, meetings, and discussions with Pennsylvanians across the entire Commonwealth, the House Majority Policy Committee conducts research and generates policy proposals aimed at improving the quality of life here in our Keystone State. I want to thank my colleagues for joining me today. We have, sitting to my immediate left, Chairman Kerry Bettinghoff, who represents the 171st Legislative District. Also here with us, we have Representative Ryan Warner, who is directly north of me and represents the 52nd Legislative District, parts of Fayette and Westmoreland. Also, we have Representative Justin Walsh of the 58th Legislative District joining us today. We have Representative Mike Reese of the 59th Legislative District, Representative Donna Oberlander of the 63rd Legislative District, and we have some other representatives that are planning to join us if schedules allow. I apologize, I missed a good friend of mine and colleague, Representative Rick Saccone of the 39th Legislative District. So I thank them all for being here today. As we said, our focus this afternoon is on the effects of opioid addiction, primarily on children and youth. I want to thank Auditor General Eugene DePasquale for the work that he's been doing over the past 2 years in compiling the data that's presented in his report, State of the Child. The Auditor General and his team talked to nearly 130 people for this special report, including more than 50 CYS caseworkers, supervisors, and administrators in 13 different counties, Fayette County being one of those, as well as 38 families who had been or are currently involved in the CYS system. According to the Center For disease control and prevention, the rate of overdose deaths, including opioids, increased 200% between the time period of 2000 and 2014. And in 2014, 61% of drug overdose deaths included or involved some form of opioid. On average, 78 Americans die daily from overdoses of heroin and painkillers. Drug overdoses are the leading cause of accidental death in the United States, and experts believe the current epidemic of opioid abuse has contributed to an increase in heroin deaths as opioid consumers move towards heroin use. Today, we look at the effects of this abuse not only on the user, but most importantly, on the innocent children that are often left stranded in the middle of these circumstances. When parents are using and unavailable to provide care for a child, when parents are incarcerated and unable to provide care, or tragically, when parents die due to an overdose and are no longer around to provide care, someone has to step in. Today, we look forward to discussing how agencies can better partner to serve their patients, clients, and constituents. We look to hear about the financial and physical stresses that grandparents or family members are bearing due to the need to step in to provide care for children who have been displaced by the epidemic. And as I said before we get to our first testifier, I just want to thank everyone here for your participation, because there's no one group that's going to be able to combat this problem. We need everyone from government, educators, prevention specialists, counselors, or medical providers to work together to reduce the effects of this community-wide crisis. Before I invite the Auditor General to make his remarks, I would ask if you have a cell phone, would you please put that in a silence mode as we are recording today's hearing. And with that, Auditor General DePasquale will turn things over to you. Thank you.
Thank you, Amy. Oh, there you go. The microphone is on. Great. Thank you. I want to thank each of you formally for inviting me. I know saw each other in the back. Representative Dowling, I appreciate your commitment to this issue. This is an issue that, I know and you know all too well are impacting kids of urban, suburban, and rural Pennsylvania, and I'm sure the rest of the United States as well. So thank you for your commitment to this. And Chairman Benninghoff, I want to particularly thank you because, I know we are members of different political parties, but the Republican Policy Committee has probably been, of any committee in the legislature, as focused on my audits as any committee in the legislature. I want to personally thank you for that, because a lot of times the data is the data and it can help drive for some real world solutions. And to all the members that are here, again, thank you for your attention to this critical issue. And then I'm going to have some brief testimony, and then more than happy to answer any and all questions. For starters, most people that read about me in the paper know that we're normally tasked with finding waste when money is spent improperly. During my, now what is scary to think, over 5 years in office, because time flies way too fast, we found nearly $1 billion in wasted taxpayer spending. However, we also are tasked with making sure our laws are carried out effectively, and that we audit county government as well as state government, particularly when state dollars are in place. So we audit all of the CYS agencies across Pennsylvania as well. And how I initially got so focused on this issue was a friend of my son's mother works with challenged youth. And this is in about 2014. I'm about a year and a half into office, and she had said that the Childline program, which for those that don't know is a child abuse hotline, was significantly strained and not effective. And as a result of that conversation, we did an audit of Childline. And she was, sometimes we get constituent inquiries that turn out to be a false alarm. This was not a false alarm. In 2015 alone, our audit showed that there were 56,000 unanswered phone calls at the child abuse hotline, that they only had the technology to handle 30 calls at a time. So when you call AT&T or Verizon, you're put on hold with a question about a bill, they can usually have thousands of people on that queue. Childline only had 30, so if you were the 31st caller and you were dropped, you weren't even part of the 56,000 unanswered phone calls. Any single one of those phone calls could have been a life or death matter for a child. As a result of that audit, which came out in May of 2016, I want to commend both parties in the legislature and the administration because you worked together, you made sure the necessary funding was in place, and now Childline is in a significantly better place. However, that also caused me to have a deeper dive into every single county. And we started looking at particularly opioids, the impact on county youth agencies, and in a sense, what was the lay of the land county by county? And what we found was quite frankly startling. In York County alone, 90% turnover among caseworkers. The CYS office in Luzerne County was actually bombed. And when I say bombed, I mean they were actually bombed with 3 Molotov cocktails from a parent that was unhappy with the decision from a caseworker. In Cambria County, there were so many kids part of their CYS system that they actually couldn't give me an actual percentage of how many kids were part of the system. Center County, where we were up in Representative Benninghoff's area yesterday, 40% turnover. And in every single one of these counties, the same story, because I've been traveling all over the state talking to caseworkers. Every single one saying that it's getting worse. Not because of anything you're doing or I'm doing. In fact, I'd like to think that what they tell us is us shedding a light on the problem is help at least raising the awareness that there's a problem. But the opioid epidemic is driving it to the breaking point. In Blair County, population of 80,000, just let this sink in for a second. They had to hire 2 additional staffers because every week in the hospital, there is a minimum of 1 baby born who's already addicted. They had to hire 2 people in Blair County, population 80,000. Blair County, and I'd say this not as a knock towards Blair County, but it is a neighborhood in Philadelphia, population-wise. So that is what is going to be, that right now, hear me now, that's coming to every single county in Pennsylvania. Now, there are some counties that are doing tremendous work. Allegheny County has put in some of the best data and analytics of anywhere in the country. Lycoming County, they have in every single high school now in the district, they have a caseworker from their CYS office. Because sometimes your guidance counselor in the guidance office in a high school, sometimes they see problems for kids before anyone else can see them because they're talking to the kids about what they're looking to do in the future. They know when a kid that may have a 3.3 grade point average all of a sudden falls to 2.2 and all of a sudden they look like they can't get through the day. And that guidance counselor, they're the first ones to see, hey, what's going wrong in that home? In York City, 10% of the kids in York City, 18 and under, are functionally homeless. And when we work our statistics statewide, we see that the number in almost every county is between 8 and 13%. That means thousands upon thousands of Pennsylvania kids are functionally homeless. A big chunk of it due to opioids. So I've given you my formal testimony. That's sort of the outline of what we have seen. We are preparing, because we did our State of the Child report that in a sense outlined the problem. Obviously, the Childline audit has been a public record, but we are continuing our travels across the state to make sure that, because as those of you that know me well enough, I don't like to just identify the problem, but I want to identify some potential solutions. So in late March, early April, we're going to be unveiling what we're going to call our own Marshall Plan for how to fix children, youth services in Pennsylvania. We want to give it to the legislature and the administration in enough time so that you can actually use that in the budget process and whatever legal fixes may be needed so that we can try to get a handle on this sooner rather than later. So Chairman Benninghoff, again, thank you for having me. And this, I will say that this hearing is the definition of timely because I think this budget year is going to be critical for the issues you're dealing with. Again, thank you for your attention and for inviting me, and more than happy to answer any and all questions.
Thank you, Mr. General. And it's not only timely for our budgets, but for the county budgets and school budgets, because we know this is a systemic event all the way across. We have Congressman Saccone and Representative Reese with questions.
Great.
Thank you, Chairman. Thank you, Auditor General, for coming. You testified before our Judiciary Committee. It was a great testimony. And if I remember, and I don't have that data in front of me now, but we talked about some of the increase in cases of child abuse that were attributed to the opioid crisis. And I didn't go through this yet again, but what was that? What was that figure that because as we talked to caseworkers and so forth, they said a lot of the increase that's overwhelming us is opioid related. Could you give us an idea about that one?
The one number, because it fluctuates all over the place, some people don't have the concrete data. But in Northumberland County alone, their caseload doubled simply because of opioids. Now, some counties it may be, they think it's about 13%, some it's 50, some it may be 62. And to be fair, very few of them have concrete that are specifically tied to opioids, but we know in Northumberland, they believe it is 50%.
Wow.
Increase.
Thank you.
Thank you. Representative Reese and Representative Walsh.
Thank you, Mr. Chairman. And thank you, Mr. General, for your good work on this topic. You mentioned something during your testimony here that it caught my attention. I used to work for Westmoreland County, and I know the importance of having good caseworkers in human services. And you had mentioned the statistic that in some of your reports, you saw a 90% turnover rate
correct.
for our caseworkers.
That's correct.
During that research, were you able to identify what was driving that high turnover rate? Was it the stress of the job, the pay of the job, just the structure? Do you have any insight on that?
The short answer is yes. I'm going to start, I think I need to take a step back and let everyone else, you may know this, and members of the committee, but I think it's important to let the public know why caseworker turnover is such a bad situation. For starters, when you are when a caseworker has a child that's part of their case file, look, I say this sometimes as a joke, but I want to make sure it's very serious. My daughter sometimes wants to file a claim for me because she can't get the new iPhone XS or something. And we've all, as parents, we deal with these disasters of, I can't go have my friends at a roller skating party. Not trying to be flip about it. The kids that are in these case systems, that's not the problems they're dealing with, okay? Some of them are waking up to their parents ODing on drugs. Some of them don't have a roof over their head, and some of them don't have meals. And so when a caseworker begins to develop trust with that child, who for every logical reason, if you were to be in some of these homes, again, regardless of what we may view about overall government spending, just forget that for a second. If you're just putting yourself in that child's world, they're not very trusting of adults to begin with every reason not to be. And then a caseworker starts to build trust with that child. And then for all the reasons we can imagine, the caseworker takes another job, whether it be a Starbucks or another county job. And as a human being, I can't fault that caseworker for doing it. I mean, and some of the county commissioners will tell you, if you're in the Civil Service Commission, a lot of the jobs in a county are roughly the same pay. Only there's one big difference. If you're in another county department, you may know your hours are 9 to 5. So if I'm going to offer you the same job 9 to 5 versus you may be on call at 10 o'clock at night, have to go to some home and maybe pull some child out of a home while someone's pointing a shotgun at you, and the same pay, I get to work 9 to 5 with a real lunch break, and no one's bothering me when I'm at home. As a human being, forgetting right or wrong, what we think is the idealistic view for the world, I get why that caseworker has turnover. But it creates a real problem for that child because now the next caseworker has to start all over again building that trust. So I want to outline why that's a problem. It's also a problem from the county perspective because now they have a budget problem. They now have the existing caseworker staff that now has to put in more overtime. So now that overtime is now time and a half. That puts a strain on their budget. While at the same time, they have to hire a new employee and go through the whole training process again. So before we go into why they do it, that's the problem of what happens to the county and to the child when that caseworker leaves. Now, why do they do it? Start off with sometimes they feel there's no path to success. They just feel overwhelmed. The amount of paperwork they have to do. Every single county. And I don't ask this, but I am sure you have liberal, moderate, and conservative people that are testifying before me, every one of them, every single caseworker says that 65% of their time is just filling out paperwork and they can't get into the field. And again, think about if 65% of our lives were just filling out paperwork on a computer screen while having to go potentially going out at night without any backup, because sometimes that's another issue I want to go into in a second, to try to pull a kid out of a home. It's very frustrating. The pay is part of it, but I want to stress, there are some people that make it very clear. Yes, who wouldn't want to make a couple extra bucks? I mean, I get that. And they all say that. But that is not the top reason why they leave. They leave because they feel that there's no path to success. Sometimes the circumstance they're putting them, what they're forced into, feels like this is way too dangerous. Even if you were to pay me, they would say, even if you're paying me $40,000 or $50,000 more, it doesn't justify it. But they all say the same thing. The paperwork is just too much and feels that they can't do their job. And I want to talk about the danger part of the job. Any law enforcement will say almost the exact thing when it comes to the two most unpredictable situations they deal with: a traffic stop and a domestic. And when a law enforcement officer goes to deal with a domestic, they almost always have backup. Yet in many instances, our young men and women are coming out of some college with a bachelor's degree in social work, armed only with a bachelor's degree, or in some cases a master's degree, are going into the exact same environment without backup. Now, many of our law enforcement officers have very good working relationship with the CYS and provide that backup. But in some instances, it doesn't happen. And again, that's something that needs to be addressed as well. So hopefully that answers the question. Yes, pay is a problem, but that's not the only problem. The biggest problem that they say is too much paperwork prevents them from doing their job, but then they also feel that there's no path to success. And who likes to have a job where you don't feel you can be successful in it? That's just human nature.
I was jokingly said it's like running for office sometimes.
Well,
Representative Walsh and Representative Saccone.
Thanks for being here, Mr. Auditor
Absolutely.
General. I know you gave us a lot of startling statistics in your testimony, but the one that stuck out most to me was your indication that statewide, Canada County, the average statistic for homeless or functionally homeless
Right.
children is 8 to 13%.
Right.
I'm a father of 3 young children, so that strikes, as most of us are, and that really hits home. So in order to explain, or more fully explain the gravity of that statistic, tell us what you mean by functionally homeless.
First of all, functionally homeless may mean that they're actually homeless with no place to stay, and it may also mean that they're moving from household to household, so that they don't have sort of the same structure of the same home to go to every night. So it can mean either one. The average York City, and I know this as a former rep, so I have this one at the top of my mind. The average York City elementary student goes to 4 different elementary schools a year. The average. That means there's some that are obviously in one, but there's a pretty big chunk that are in 6, 7, or 8. And without, again, I'm just going to give you the real life here. I have 2 teenage kids, and without trying to compare the circumstances, being a teenager is a challenging time for any kid. I mean, it just is. There's a lot on their mind, both what they're going through, changes in themselves, and some of the changes in going from really being a kid to expected to be a young adult. There's a lot of changes to go with that. That's a challenge in and of itself. Now combine that with being functionally homeless, without good, healthy meals, and still having the same competition to get in the same colleges or trade schools as the kids that are with, that are our kids, let alone people that even have more means or maybe a little less, but are in stable environments. Because as I know this now with my son in the college application process, they're not just competing. When we went, you're sort of competing in your own area. If you're trying to get into Pitt or Penn State, this is now an international fight to get into a lot of these high-end schools. And I mean, if you're a functionally homeless child that's going to 4 different elementary schools a year without a good meal, how can we expect that child to compete to get into some of these schools, let alone just be on a path of success the rest of their life. And why so many of them, not all obviously, but so many of them go down a different path is because it's that hard to get out of that cycle.
Pretty sobering. Representative Saccone?
Thank you, Mr. Chairman. One more question, since you identified this problem of 65% of the time being, paperwork driven. And I see in your report, one of the recommendation was hire someone to do the lower skilled part of typing up the notes and so forth. But having served with you in the legislature, I know you're got to be thinking about ways we can do something legislatively to reduce that paperwork. Did you have some recommendations for that?
Yeah, every county I've been to, and thank you, Representative, for the question. Every county we've been to, I've asked the caseworker. I don't want the answer today, but before our plan comes out, I want them to give me, because I want to hear from them. Look, we make this, we've done this too many times in Harrisburg, where we get together, in a committee hearing, and we decide what's best for the paperwork. And it's happened before. Both parties have done it. Like, this is not a condemn or condone. It just happens. And without hearing from the caseworkers of how does this actually work in the field. So I'm asking them for the recommendations, and then I'm going to bring that to you in late March, early April as part of our plan, because I want to hear how can we actually maintain appropriate accountability while not taking them away from the field too much. So it's going to be coming, but I want it to come from them. I don't want it dictated from Harrisburg.
Chairman's prerogative, I have my own question. As a follow-up to many of these, you talked about some of the impacts on CYS. I'm just curious if you saw specific new impacts on children and youth directly related to the opioids. I mean, I think some of the changeover in the staff burning out or wanting Monday through Friday, 9 to 5, is a ongoing issue and always will be. It's a low-paying, high-stress kind of industry. But I'm curious if there's specific impacts you saw that are direct correlation because of the opioid crisis.
Yeah, the direct impact is on infants being born addicted to opioids. That explosion is specifically tied into opioids. Now, I believe that Northumberland tied in the 50% increase is directly tied. Clearly, the higher caseload. And also, the caseworkers have also said, again, this is more anecdotal, but again, they're the ones going into the field. And that is, when they are going to the homes now, the environment they're walking into, they said, is dramatically, I would say, more dangerous for the child. I'm not talking about necessarily from a violent standpoint, but more kids are left to fend for themselves because the parents are just, this is not a situation where the parents are involved but make some mistakes. And again, I'm not, any child that is harmed, whether it be a parent or someone else, that's wrong. But this is not a case where, when the dad comes home and maybe has done something wrong to the child, but a lot of days the dad's trying to be a good father. This is where the kids are left to fend for themselves and there's no parent involved. That's what they're seeing more and more, and the belief is that that's directly tied to opioids.
Thank you very much. We appreciate it. Anyone else? Seeing none, we really appreciate the General's time coming up to this hearing, and we will continue to work in tandem with you to try to find solutions, which the legislature may or may not be able to do, but we'll work with other county agencies.
My pleasure, Mr. Chairman. Thanks for having me. And
Thank
good luck
you.
in the rest of your work.
Our next panel will include Jana Kyle of the Fayette County Drug and Alcohol, as well as Gina Dioria, Fayette County Children and Youth Services. Unfortunately, for those of you who have been watching the news over the past several days, our district attorney, Rich Bauer, has been extremely busy, and because of that was unable to join us today, even though he is listed on your agenda. He sends his apologies for being unable to be part of this conversation, but is working with us in tandem to fight the problem. For those of you who are just joining us on the audio rebroadcast, this is a hearing of the House Majority Policy Committee on the effects of opioid abuse on children and youth. We will go ahead and allow both of you to provide your testimony, and we'll hold questions to you as a panel, if that's okay. And we will begin with Jana, if that's okay.
Apologize. When testifiers come up, make sure the green light is on, and if you keep your microphone close to you, because those on PCN won't be able to hear it. Thank you.
I am very honored to be here, and I truly do commend you for sitting in and asking to have a discussion that is so open and honest about the problem of addiction and how addiction can affect all of society, including our youngest, most vulnerable, which is our children. My name is Jana Kyle, and I am the Executive Director of Fayette County Drug and Alcohol Commission. Fayette County Drug and Alcohol Commission is the single county authority for Fayette County. And as many of you do know, the single county authorities received state and federal dollars through the Department of Drug and Alcohol programs to provide or to ensure the provision of services such as prevention, intervention, treatment, and any services for gambling to deal with addiction. We assess the needs at the local level and ensure the provision of those services. Fayette County Drug and Alcohol Commission is also a functional unit SCA, which means we provide prevention, intervention, and treatment services in-house with our case management unit, and then contract services throughout the state for all levels of care. Many statistics have been thrown around about the opioid epidemic. It is a multifaceted problem that we have in Fayette County along with the state of Pennsylvania. Just in a 5-year period of time, from 2012, we have had a 433% increase in the number of deaths that we have experienced locally. Opioids, whether they are prescription, illicit, have accounted for 84%, have been shown to be included in 84% of the deaths that we have had last year. We are one of the counties that have seen the surgence of carfentanil, fentanyl, and opioids with prescription drugs. Whenever there is an overdose, and if that overdose is a death, that affects families in many ways. That is a parent, a sister, a brother, a father, an uncle, or even it could be the child. Locally, if we want to look at the overdose death rate, our average rate of age is between 45 and 54 years of age. If you look at age, those are parents, and those are young grandparents. So by looking at that, that does trickle down to look at the effects of a family becoming torn apart due to addiction. What we have done to look at this and to do things about it is we have looked at this in a collaborative way. To my left is the administrator of our local children and youth services, who has been a champion of ours and is very willing to work with us. She sits on our overdose task force as we're working to gather what we can do with information. Once we have our data and we can make educated decisions, where to go, what to do, who to focus. We have also collaborated between our agencies in providing assessment services on site in her building. We know that in order to get people help, we can't always expect them to come to us. We need to go to them. We also don't want to enforce a stigma that children and youth sometimes has, that they are an agency that only is worried about taking children away. But if we can help a family stay together and not have children affected by addiction in a negative fashion, and we can work with a family with addictive issues to help ensure that that family stays together, one of the ways that we can do that is through working on site. When they are working with a family, that we can also work that family and deal with the addiction issues. This was a project that we had just started a few months ago, so we are starting to gather the information, but it's not a project that we're just going to let go in a matter of 2 more or 3 more months. This will be an ongoing process that we can hope we can make it better to work with that family. Another thing that we have recently been doing with children and youth is we have been working with the family foster parents to talk about addiction, for them to understand what addiction is. Because as a foster family, they are receiving the children, and in many times, those children are in placement because of addiction issues. We find that it's easier for the foster parent to understand all the ramifications and all maybe the behavioral issues and all the tantrums that may happen because of what that child experienced at home. But if you understand that addiction is a disease, and the parents aren't just bad parents, but having their parents with a disease, with that education, then we are hoping to help our foster parents provide better services to the children who are exposed to addiction. That in itself has been very enlightening to me because I have been one of those presenters as we've been doing it, and to interact with the families and to hear their questions and to take some of the myths and stigmas away is rewarding for me because that's what I want to do. My job as an administrator is, I keep telling my staff, we are in the business of providing drug and alcohol services, and our job is to do that well, no matter how we need to do it. When we talk about children, one of the things I do want to mention is prevention. When we talk about prevention, we talk about prevention all across the ages, from young to old. We are dealing with an epidemic that people are using drugs, but we also have to deal with the fact that we have to prevent and educate people from not using drugs. Again, our most vulnerable is our children. So we have been very lucky in Fayette County that we have schools who are willing and eager to support evidence-based programming in the schools. We are in every school district, in every public school district in our county in providing services. We will work with any school that will have us. We offer student assistance programs in the middle school, the high school, and the elementary school to work with identifying any problems or situations that may stop a child from fully succeeding at school. Whether that's a school problem or a home problem that moves itself into the school, we are there to work with the schools. We have an evidence-based program, I said, on the elementary level, on the middle school level, and on the high school level. And I know I keep saying evidence-based programming because evidence-based programming has shown in the long run there is a return on the investment of time. The return on that investment is there are an increased likelihood that children will not use drugs, alcohol, and in some programs, a diminishment of delinquency or negative behaviors. We truly support programs that are going to teach children coping skills and positive decision-making. We have also been working on a collaborative basis with our EMS. When we live in our world of addiction and drug and alcohol, we think that because we know something, everybody else should know it. So we sometimes figure that people should know how to get a hold of us because we know how to get a hold of us. And that's not easily done. People don't know how to access treatment. We have been working with our Fayette EMS when they are on overdose calls or a call that comes out to be an overdose call. With our local center of excellence, we have put together a packet of information. And that packet of information is left behind when EMS leaves that house. If that person has decided not to go to the emergency room after a successful reversal, at least there is information that is given to them on how and where to access treatment. We have had successes with that, which we have started since this past July, and to date, we have given out over 425 packets of information. We are also working with our EMS to do a community paramedicine program, in the fact that we will do aftercares for people who are willing to receive information and a personal contact with EMS and a drug and alcohol specialist. We will go back to their home to do education and to try to engage them into treatment. And working with Highlands Hospital as our center of excellence, they will also be working with us to help continue that engagement process, to get a person into treatment and into all the levels of care that they can. I don't want to go on. I know I can. I won't in the matter of time. But the biggest thing we have to understand is whatever we do as drug and alcohol and how we're collaborating is with the effect and effort to destigmatize addiction, and not that it's a moral failing, but that it truly is a disease in the medical sense. Thank you.
Thank you. I'm grateful for the opportunity to come today and to talk about this subject. It is very good to see the problems that affect our kids every day being talked about, as Janice said, in a very honest and open forum. When I started my career in child welfare, I soon found out how naive I really was. And being born and raised in Fayette County, I thought, oh, we don't have these problems, when in reality, we really do. I grew up in child welfare. I started my career here 25 years ago as a caseworker, and I worked my way up into becoming administrator. And throughout the 25 years that I've been here, I've seen so many changes, some very good changes and some not so good changes. When in 2014, the 24 different legislations came down, that hit us hard. We had new rules, new guidelines, a lot more paperwork. And from our perspective, it did nothing to keep kids safe. It did nothing to change the problem. It did create new problems for us. Our turnover increased dramatically. We didn't have the appropriate funding to implement what we were being asked to implement. And it was just turned into a spiral effect. When you compound that with the problems that already existed here in our community between poverty, lack of education, truancy, and then you added the opioid epidemic into that, our numbers went completely out of control. And I shared in your packet some statistics dating back to 2012 regarding our numbers of referrals, our numbers of children in placement, and our numbers of cases that are actually accepted for services. You can see that in 2014, 2015, when the laws changed, our numbers went up from, in 2012, where we worked with 759 families, to 2015, where we worked with 1,988 families. And they've continued to grow. For the past 12 months, I had 60 babies that were born addicted to drugs. I just found out that this morning, we got 4 new referrals of 4 new babies that are suffering from withdrawal. I can tell you, in my entire career at child welfare, I've never had more than 20 babies in a 12-month period of time. These kids, what they go through, going through the withdrawal, is horrific. They suffer. They're given more drugs to try to combat the withdrawal. In many of those cases, as opposed to going home with the parent, they're going home with grandparents, aunts, uncles, who are attempting to care for these kids that are extremely cranky, extremely irritable. It is a struggle for them, and they need supports, and they need financial assistance. Many of them are on fixed incomes, receiving public assistance themselves. We've heard the testimony earlier about the turnover within the agency. I can speak for myself. I got involved in child welfare because I wanted to make a difference in my community and for families, because I strongly believe in families. What kept me here for 25 years was the fact that every time I thought I had enough, something really good happened. A family got reunified. A kid came and said, "Thank you, you made a difference." Something positive happened. That doesn't happen much anymore. I see caseworkers that are leaving because they just don't see the difference. They don't think they're doing anything good. You read in the paper, you hear on the news how child welfare failed this family. You don't hear how we successfully helped that family. And that's a struggle. Worst case scenario, a child dies. Children are not supposed to die, but they do. And that caseworker that has been working on that case, that has that child that died, they start to look at themselves and, what did I miss? What didn't I do? What could I have done differently? And it's usually not too long after that that we see that they're finding another career. We are a 24-hour-a-day, 7-day-a-week agency. The starting salary at Fayette County Children and Youth Services is $29,484 for a bachelor's level social worker. Many of them can't afford to pay their student loans on that salary. In addition to that, they're carrying very high caseloads, and many of these cases are so complex because, yes, we do have addiction issues, but there is others. How many of our families are using drugs and alcohol to self-medicate because they have significant mental health problems that are going undiagnosed? We have had great difficulty working with families because of the significant labels that get put on them and the community's view of somebody that seeks treatment. I'm not an addict. I don't have a problem with drugs. My doctor prescribed these for me, so I don't have a problem. It is a struggle to work through that level of denial, and that takes time. Our staff wants to do that. They want to work cooperatively with drug and alcohol and the other social services in our community to help the families. And the reality is, when you're looking at 30 families with 70 kids, how many hours a week can you spend with that family? And how much difference can you make in that 1-hour home visit? because it's not a lot. The caseloads need to be cut back so that we can effectively make a difference, which means we need staff. We need qualified, competent people that want to work in child welfare. Child welfare is not your typical social services. We're not a voluntary service that people come to. We're forced upon people. Nobody wants us on their doorstep. And if you can stop and think, those of you that are parents, how you would feel if I showed up on your door and say, I need to speak with you because we've got a report that you may not be providing for your child the way you should be. You're not going to want me in your home either. And that's what my staff faces every day. They go out to these homes, they knock on the doors, they hear the kids in the home, they look in the window, they see mom passed out on the kitchen table, unresponsive. Much to my staff's amazement, I guess, drug and alcohol came up and trained us all on Narcan and how to give Narcan. I had many, many of my staff that did not want that. They didn't want that responsibility. And what changed was when they found a mom unresponsive on a porch and had to wait for 911 and for EMS to come and know they couldn't do anything to help her. It was one of my very young workers that became very traumatized by finding that situation and has struggled with that to this day. In addition, we see grandparents that are now in the role of parents, aunts and uncles that now have to be parents, kids that don't see their parents because they're in the throes of their addiction, and they have all the feelings that go along with that, the embarrassment, the shame, the anger, resentment, that aren't seeing their kids. So we're raising a whole population of children that are going to have problems functioning, whether it be from being addicted at birth or the whole dysfunction of their lives going forward. In Fayette County, we're very lucky. We have a lot of services, and most of us have been in the system for a very long time, and we all like each other for the most part, and we get along, and we're very creative. And if we can figure out a way to do it for free, we're going to do it because we've struggled for many years with funding in our county. And other counties don't have that. Other counties aren't as successful in the collaboration. When I go to statewide meetings, I hear, oh, you talk to your drug and alcohol people? What do you mean? We get along and we help each other. When I approached Jana about the possibility of having somebody in our office, she was like, absolutely, we can do that. When do you want us there? How do you want us there? And she was lucky enough to be able to do that. And we'll find a way, somehow, some way, to continue that. Ultimately, I'd like to take it to the next level and maybe go out in the field with us, go to their home, where they're at, what they're seeing, what they're doing. Again, all takes resources, all takes human beings to go and do this. If we don't take the time now to effectively make a change in our kids, in 18 years, in 20 years, in 21 years, we're going to need more prisons. We're going to need more money through the welfare system because we're going to have a whole generation of people that cannot function in our society and are not going to be able to make a difference. So we have to do something at this level right now. We have to be able to support the families. We have to be able to support the kids. And we have to close all the barriers that allow us to do that. Again, I talk about we can be creative, but we still have laws we have to abide by. Jana has her confidentiality regulations. I have mine. There's certain information we cannot share, which tends to be a struggle sometimes. because we know that if I can give her just this little bit more information or vice versa, we'll be more successful in helping families. It's a day-to-day struggle. As we look at this crisis and we look at how we need to move forward, I ask that we truly look at what's going to make the difference with families, and it's not going to be the paperwork, and it's not going to be the legislation that keeps us from talking to one another or keeps us from working together. We need to have the ability to take funding and to truly use it where it's needed in our community and to be able to share resources. It's not a children and youth agency problem. It's a community problem that we all have to come together and we all have to work on. And I just want to end by saying it's a lot easier to build a child up than it is to repair an adult. Any questions?
Thank you very much. I actually read that sentence at the beginning of your testimony. Maybe I'm a little dyslexic or something, but I found that particular statement to be very powerful. I want to ask you a quick question, and we'll open up the questions to the member, and that is, could you take a couple minutes just to share with us a little bit about these babies and what is their long-term medical future? I don't know what extent you can say, but we're hearing they're born addicted. How are we able to address that? And are these high risk for future addictions or other systemic problems? If that's something out of your realm, fine. If something you want to give some comments on, I think it would just help us comprehensively. And we're talking about a pretty large number of children here.
I think a lot of it, and Jana, please chime in, a lot of it has to do with what the usage of the mother was during the pregnancy, what she was using, how often she was using, and at what points during the pregnancy. I do believe that it does predispose them for future addiction issues. And I believe that we will find that these children that are born with substances will have learning difficulties once it starts at school. It is a trauma. It's not something that was supposed to be put in their bodies.
And if I may, as Gina had said too, even with a person who is using opioids or a drug during pregnancy, also what kind of prenatal care were they getting? Mm-hmm. How much were they under a doctor's care, and how honest were they with that doctor too? And the other thing we have to look at is when you have these babies being born addicted and going through withdrawal, we have to work out a system of how do we reintegrate them back into the home when the home itself is in upheaval. And what services can we provide, and how do we access those services with the family because of the addiction issues?
Do we find some of them to have other abnormalities subsequent of that addiction outside the addiction itself?
You will have some behavioral issues. You may have some learning disabilities coming forth. There is a whole myriad of problems that could happen depending on what the drug was. As Gina said, when it was ingested, during what phase of the pregnancy. There are a lot of things that can contribute to problems. But I think we can guarantee to say that no child would not be affected if they're exposed during pregnancy.
Yeah, sadly, nothing good comes out of that.
Exactly.
I do want to let our listeners know we've been joined with Representative Eric Nelson. We'll hear from him in a moment. Representative Dowling and then Representative Warner have questions.
Well, first off, Jana and Gina, thank you for being here today, and I want to commend you for your proactive approach in looking at a collaborative way to share resources between your two organizations. My question is to that extent, what can we do legislatively or financially to support collaboration between your two agencies? And I guess I want to break that down to one specific first. I know you're both bound by confidentiality of your clients. would you envision any type of a fix that could happen to allow you to share information so that we could be more proactive in saving the children that are involved in these situations? And then maybe you could go on to the other parts of how we could support this through funding.
I know the drug and alcohol regulations are much stricter than the child welfare regulations. And I know one of the most recent legislative changes allows child welfare to gain access to a child's medical record without a release under certain circumstances. If there could be something looked at in that direction that allows for families that are jointly in both of our systems that we could share information more freely. And I don't know how that would play out from a drug and alcohol perspective, but from my perspective, that would be helpful.
The perspective of confidentiality with drug and alcohol is because of the stigma associated with drug and alcohol. Because information in the wrong hands can do a lot more harm than sharing information. If I give Gina information on a client that we are serving, and that information can be used for good, that's great. But in the wrong hands, that information can be used as a detriment to the people that we're trying to serve. It becomes a double-edged sword. But the real reason for the stricter confidentiality is because of the horrendous stigma that is associated with addicts and people going through addiction.
Is there any additional funding other than adding caseworkers, funding that would allow you to collaborate your efforts better? I know you're currently doing, as your written testimony states, 2 half-days a week in the other's office. Is there a way that that program can be expanded, and would you see value in doing so? I know it's early on to have quantifiable data.
Money. It comes down to how do I pay for that person to do more outside of the office when I also have to have people in the office or even to have more mobile assessors. It costs money to do that. Always more money. But I would ask if I can dream, I would like to have more money with less restriction. It can only, not funding that says you can only use it for this type of disorder, for this type of personnel or population, to be able to say, you prove, this is how you can use the money, you prove it's worth with outcomes. Because the needs of Fayette County are not always the same needs as Philadelphia. We have issues. We may all have drug and addiction and children and youth issues, but the actual issues may be different and our resources are different. So I would, if I could dream, I would like to have funding without as many restrictions, but with the onus being we could provide the outcome on how that funding was used.
And I would have to agree with that statement. We get a lot of funding that is earmarked for certain popular topics at the time, and that may not be what we need at that given point in time. And not having the flexibility to move that funding around and use it where the needs really are, that money then comes back. It looks like the counties don't need this funding when we just need it for something different.
That's the specific stuff we need to hear. Representative Warner, then Representative Saccone.
Thank you, Chairman Benninghoff. Gina, thank you very much for your testimony and all the testifiers for being here today to discuss this extremely important topic. I would like to expand on the question that Chairman Benninghoff had asked, and I know that the Auditor General brought up the statistic for Blair County that 1 child a week was being born addicted to opioids, and Gina, you mentioned 60 children in Fayette County. That is a troubling number. And in the President's State of the Union address last night, for those of us that saw it, we heard the heartwarming story of the police officer that adopted a child from a mother that was addicted to opioids, putting on front stage just how big of a problem this truly is nationwide. And you'd given a lot of good information on Chairman Benninghoff's question, but I guess I'm kind of interested in, one, what's the procedure for identifying a child that is addicted to opioids? At what stage during the pregnancy does this have? Is it normally, pre-birth, post-birth? What happens to what are the procedures for the child after that? You had mentioned that they, a lot of the times they're homed with grandparents, aunts, and uncles. Is this mandatory? Or are they offered back up to the mother immediately after? Is this a choice? And what, he kind of went into the answer a little bit, but the success of, are we able to get these children unaddicted successfully from the opioids?
An assessment's done. In many cases, the mother is not getting prenatal care, so there is no identifying it prior to birth. In the cases where there is prenatal care, the obstetrician would be looking for any signs or symptoms of addiction. We've had some doctors that are actually drug screening for their patients during the prenatal period of time. Again, you've got to go to the doctor for that to happen. Many times at birth, they're either seeing something that alarms them during the hospital stay with either the mom or the baby, and then they're testing both people. That's how we're getting most of them. And with the law changes, any child born affected is automatically referred to our agency. We do send a caseworker out immediately when we get those referrals. They do an assessment on the mother, the father, any other people living in the homes, any other children that may be in that home, to determine what is the significance of the issues and is this child safe going home with the parent. We encourage a drug and alcohol assessment, inpatient rehab if needed, outpatient, whatever the recommendation would be. More times than not, we're hitting denial at that point. So that's when we go to the family and say, can we come up with somebody else? Can somebody else supervise you with your baby? Can somebody else provide care? If the family's cooperative with that and there is an appropriate family member, the child's better off with family than with a stranger. If we can't identify family, then they come into foster care. Many times the babies are hospitalized for a period of time where they are going through the withdrawal symptoms and using medication prior to coming into placement. So there can be a whole host of things, but a baby cannot provide care for themselves. And if we don't have an adult that is capable of doing that, the child can't go home. And a mother that is addicted to heroin probably is not going to be able to provide that care.
Do you think lawfully right now in the state of Pennsylvania, are we providing, as the state, are we providing enough care to protect these children that through no choice or fault of their own are being born to, in your opinion?
I think that's getting into a touchy subject. I can speak from a personal perspective. It's very difficult. When a woman is addicted to drugs, sometimes she doesn't know she's pregnant, so she doesn't know what she's doing. Sometimes the addiction is just too strong, and she can't overcome it. I know there's been some discussions about the criminality of that. I'm very torn on that from a personal perspective because I don't think that anybody purposefully wants to hurt their child. I think it's the addiction. So.
Thank you very much. It is a very difficult situation. There are no easy answers, and there's not going to be an easy solution either. It's going to take a lot of work, and again, I appreciate all the efforts that you guys do for our county. Thank you, Mr. Chairman.
Thank you.
Representative Saccone and Representative Nelson.
Thank you, Mr. Chairman. Thank you for your testimony. Thank you for what you do every day in our communities. Really appreciate that.
Thank you.
I want to focus on prevention for a second because There are a lot of suggestions. It's a multifaceted problem, as we know, but in the area of prevention, I'm trying to get at new ideas, and we're hearing a lot of them. One is from the drug companies itself with these opioid management programs that they have to kind of steer people away from getting prescribed opioids to begin with, which would take at least a chunk out of this problem.
Absolutely.
Another one is we talk about this is a societal problem, and inoculating our children by getting them back involved with things that are wholesome, getting them back into the 4-H programs, into the FFA, into the scouting programs, church programs. These societal community things help inoculate. They don't cost the taxpayer any money, but they help keep our kids active and off of drugs. And I'm not sure we're spending a lot of time, enough time talking about that. We kind of look for, give me more money, give me more programs, pass more laws, and we need some of those. And we've passed, I think, 8 or 10, 12 laws in the state legislature that I think are helpful, but they're, it's only part of the problem. So I'd be interested to hear any of your comments on those type of things.
Absolutely. Those are protective factors that we have to foster in children. When you have children involved in a community, when you have children involved in the school, when the children feel a sense of attachment to family, home, neighborhood, church activities, those are proven to show that negative behaviors, including addiction, negative behaviors such as truancy, are going to decrease. So any opportunity that we have to raise protective factors such as engagement in our community, church and school and family are absolutely what we need to do. Long ago it had said it takes a village to raise a child. Well, it does in certain ways when that whole village is invested in its village. We all need to step up and say, as a member of our own society, we need to help each other. So absolutely, anything that involves increasing protective factors and engagement are proven to show prevention.
I agree 100% with what Janice said. We need to have the family values, the community values. The kids that are active in those activities they have somebody. If there is something, they have somewhere to turn. Unfortunately, the kids that cross my door usually don't have those in place.
I think it helps to inoculate our children, and I really do. I'm going to borrow your statement because I love that I saw it in your testimony. It is easier to build a child than to repair an adult, and we have programs out there that have been proven for decades to do this, but we're kind of shunning those for I don't know what that the world has to offer us today, but I think we need to promote those more. So thank you again.
And if I may, we also need to teach them again, because we do have a generation of people who may not have been a part of a society who had been engaged in their neighborhoods and churches and families and activities. So we do have to bring it back to the forefront again and reinforce it and encourage that.
Thank you very much, both of you. Representative Nelson, Representative Oberlander, Representative Walsh.
Thank you, Mr. Chairman. It's some tight quarters up here to be able to help with the process. Your testimony was fantastic, and there are a host of questions, that I have floating around, so I'm going to try to be consistent. One, I definitely appreciate the endorsement for what we refer to in Harrisburg as performance-based budgeting, giving the agencies flexibility and then holding them accountable for their actions, and so I'd like for you to maybe provide one part of the question, a little bit more information and more specific examples of how we can baby step our way to that, because Harrisburg is those agencies, in my opinion, are very nervous about performance-based budgeting and having that flexibility. The second part of my question is, in listening to both addicts, recovery agencies, even success in college, I hear the recurring theme of effective coping skills really being a key element. And so I was, it was outstanding to hear that you're incorporating coping skills as we're identifying young people or people at risk. And I'd like to see if you could expand more specifically the types of coping skills. And I know it's sensitive, but the inclusion of a faith-based aspect or element in there, because again, government gets nervous about faith-based, but listening to both individuals dealing with addiction and agencies, it seems to be a very effective tool. Two different questions. Thank you for the flexibility, Mr. Chairman.
Let's go with the faith-based first. There is not one way to treat addiction. There is not one way to prevent. It's what works with a person. So I would say faith-based for some is very important, and it works with them. If that's a place that resounds with someone and that's what they're going to listen to, absolutely, because it's part of a community. It may not be the one for everyone, but it is one for some, and that's important. With the performance-based, I don't have a specific example, but I believe, this is me talking, not me as part of Fayette County Drug and Alcohol, but I believe that with the right plan and the right intentions, which may sound very rose-colored glasses, with the right intentions and collaboration, we would be able to prove what we are doing. It shouldn't be a fly by the seat of your pants. It should be a planned endeavor that is strategically placed, that is evaluated, that is reinforced, that is adjusted, as any business plan would be. This is what we're going to do, and this is what we need to do it with. Give us the money, we can show it. Most grants operate that way. You have to prove why you're asking for money because you have a plan in place. With performance-based funding, I have ideas for drug and alcohol treatment, prevention, case management to do things based on what Fayette County may need and what Fayette County has to offer. Because as Gina said, we are truly blessed to have a service in Fayette County that a lot of people and a lot of agencies are truly willing to work with each other without spending a dime, having to financially support somebody else. We're doing it because it's the right thing to do for us. And we often share the same clientele, and if it helps me, it's going to help her, and it's going to help another agency, so it helps the community. I'm not sure that I answered your question as specifically as you wanted.
No, that's outstanding, and really the perspective is giving the people who know the most ability to be able to do their jobs, and we have to have the courage to allow that to happen. So that was an excellent example.
And I think I would agree with that. Under the child welfare system, we do the needs-based budget and planning. And we have to have a crystal ball to say what's going to happen 2 years from now, because that's really what we're budgeting for. That becomes problematic because my fortune-telling skills are not good at all. I can tell you what I need today. I can tell you chances are what I'm going to need 6 months from now, but 2 years from now, I'm truly guessing. If we had more flexibility with that money and we could look at where we're at, what we're doing, what services are working, what services aren't working, and we had that flexibility to do that, I think it would help the community as a whole. And as far as accountability, I think we've already got it in place. We just need to utilize what we've got. Come into my office. Come see how I'm spending my money. Come see how my outcomes are, what am I doing good, what am I not doing good. I'm open to that. I don't know many people that would not be open to that. I don't have anything to hide, so come and see. And regarding faith-based, I think that everybody needs to have something they believe in. And again, many of the families that come before me do not have that. They don't have that foundation. They don't have a faith in anything. They don't have faith in the system, let alone a religious faith. That is something that we learn as small children, we grow up with, and we have many faith-based organizations in Fayette County that are willing to work with our families without forcing their belief system, just being a support. And we utilize those, probably more than they ever thought they wanted to be utilized, but we do. And we're seeing more organizations in light of the opioid epidemic, more religious-based or faith-based people stepping up, wanting to do more.
Absolutely.
And we're taking them up on it.
Thank you, Chairman. Thank you, ladies, for your testimony. And thank you for the good work that you do. As a former county commissioner and working directly with drug and alcohol and children and youth, I truly appreciate what you've done with the little that you have access to. My good colleagues have already touched on the faith base, so I crossed that off my list. And they've already touched on the block grant, so I'll cross that off my list. But you had mentioned regarding the 24 law package that was put in place to protect our children, created more paperwork, and really didn't do anything to protect our children. And I would love to have more specifics if you think that there's an opportunity for us to go back and look at that and tweak and make it better for you. I'm more than happy to hear that information. That's terrific.
Well, I will tell you that I am currently sitting on several work groups that are that are looking at the recruitment and retention, the paperwork reduction, and most recently, one in regard to training and hiring practices. And I think that we're going to come out with some really good recommendations out of those work groups, and I've been very blessed to talk to some really great people across the state with some really good ideas. I think that we need to look at those recommendations, and again, as was said earlier, people that are doing the work probably have the best insight. I'm not doing direct service anymore, but my caseworkers will tell you they'd much rather be out in the field talking to their families than sitting at a computer.
Thank you. Thanks for that very much. And this is a great segue to my next question. In the Auditor General's report, it mentions the State Civil Service Commission statistics, and I'm looking at those, and I see that it looks like it's a revolving door.
Yes, it is.
I have heard in my own community that some of those testings are not open. They've been trying to test for that. It looks like caseworker 2 is your largest area of problem. Are you a county that requires the civil service test?
We are a civil service county at this point. I've met with my commissioners, and we've had conversations. Both my office and our Fayette Behavioral Health are the only two left in civil service, and we're actually starting to look at the possibility of getting out of that.
It appears that that might be a trend that we'll see coming.
Yes,
Because
I
because
think
I
it's
am
already
hearing
there.
that more and more often, and if there's another opportunity for you to get the people that you need who are qualified without having to wait for testings and those kinds of things, it might be helpful. So thank you again for all you do, and thank you, Chairman.
Thank you, Chairwoman Oberlander. Donna serves on our leadership team. We're very glad to have her here as well. Representative Walsh.
Thank you, Mr. Chairman, and thank you, Jana. Thank you, Gina, for your testimony here today, and thank you for all the difficult but appreciated work you do here in Fayette County. And I hope you understand that we're here today because we understand the gravity of this problem. In fact, Jan, I don't know if you know this, but this is the third time we've been in the same room in the last 3 weeks. I got
Am
to
I
hear.
stalking you or are you stalking me?
I'm stalking you. You're doing. I saw you at Pitt of Greensburg. I also was at the second Mon Valley Opioid Coalition meeting last week, and here we are today. So it is something that we are taking very seriously as a legislature. But I wanted to ask you, you touched on prevention, so I wanted to talk a little bit about prevention. Do you feel that, is there collaboration between the Drug and Alcohol Commission and the school districts here in Fayette County in regard to educating our students about the dangers of prescription drugs, opioids, and drugs in general?
Yes, there is. We, as I had said, we are in every school district with student assistance. We are in some of the school districts with evidence-based programming. The evidence-based programming isn't specifically towards opioids, it is about substance use and abuse. So we don't want to just prevent the use of opioids, we want to prevent the use of dangerous drugs and dangerous behaviors. And one segues into the other. We have some schools, and we are having more schools getting on board with the fact that with evidence-based programming, not just one-time events, but chances and opportunities to educate children with a skill of decision-making and coping, that those are skills that can be carried on beyond the 14 sessions that we may have them in a grade. We have schools that are very willing for us to come in and provide technical assistance as they have their teachers do programs, as well as my prevention staff going in to do programs within the schools. So I am very lucky with my school districts in Fayette County that are open to have that happen and open to have more programs coming in.
Well, I don't know, then I'm not sure that this would be an appropriate question for you, but do you think there's anything more that the PA Department of Education could be doing in that regard?
I think one of the things would be really to support that. Years ago, when there was safe and drug-free funding, there was money associated with services. I can say we were in the schools more often because of the funding availability, that we could hire more people to be there more. Now there are mandates that are unfunded, and it's hard to fit it in, or it's not as easy to fit it in as when there was funding associated with it.
Thank you very much.
Thank you all. Very good questions. If the ladies will indulge me, I have an observation / question / comment. I find in these hearings that we've done across the state, today not being any more unique, that we have a tendency to digress the conversation towards teenagers and our youth, and yet we start off the conversations talking about the majority of addicts being 40 to 50. And I only point that out is because I think that can be a disconnect, and if we aren't careful, our actions and our directions of correction may couple that, and I think we have to be careful about that. While it is always good to try to curb any youth getting involved, I think we need to fundamentally realize that this, on a larger scale, seemed to start from a prescription drug phenomenon, and then when that access was not available, then they're turning to the street. So that's kind of my statement, my mini sermon. Take it to my question specifically, and we may be premature in asking this, but in some of the legislation we passed, one of it was the Pennsylvania, prescription drug monitoring program. I'm curious of the results or whether or not we're seeing any significant impact, as well as in your own testimony. And as I've heard in a lot of other hearings, we all talk about the number of pounds of drugs that have been taken off the street. And I think that's all great, and I think it's all good, but are we quantifying that to say, and this is the impact of that? We can come up with a program of the week, but if it's not long-term having a problem, we're just talking about new people with the same problem. So the question overall is the prescription drug monitoring program starting to curb those individuals that are getting addicted? And by cutting off the supply, because as I read through your testimony, the majority of the people answering your questionnaire several years ago was, I got the medicine out of my parents' medicine cabinet. Mm-hmm. Are we seeing significant changes on the front end. We're not going to change the addicts in the middle through legislation. That's through the counseling, the treatment, and sadly, in some cases, their own demise. How are we doing on the front end of this thing?
I'm not sure that I have the information available to me at this moment to be able to tell you that it's a certain percentage, a quantifiable number. I'm not sure that the prescription drug monitoring program has been in existence long enough with the teeth that it has for us to see a downward climb. If a person is in the throes of addiction and they are doctor seeking, they may find ways around that anyway and go to the street, and I can't correlate that a person went to the street just because of the prescription drug monitoring program. But it's one of the tools in a toolbox for prevention. And when we add all the tools together, then we have a really diverse, good toolbox that can handle a lot of different problems. So my answer to that is the PDMP is good as a prevention for future and a potential means, if it can be used properly, to help get people into treatment. As I said, we are a functional SCA that we provide outpatient treatment. Our doctor uses that PDMP because we provide Vivitrol and Suboxone. We use medication-assisted treatment. We check for every client that we serve. We check the PDMP to ensure we know what we're doing, but we're trying to assure what the client may be trying to do. We have used it as a tool. And our doctor talks to primary care physicians and encourages that use too. So I can't exactly answer the specific question, but as a tool, the prescription drug monitoring is a great tool to help with the problem.
Thank you. And as I said, it may be premature in the implementation of the prescription drug monitoring program. Obviously, our hope is that it is going to curb that. And unfortunately, we're still seeing the number of deaths across the Commonwealth going up. It has not decreased. And we can only hope the number of the people getting addicted starts to go down, regardless of what realm they get to that path. Did you want to add anything to that, Gina?
I think that it's a culture. When we look at, we didn't get here overnight, and we're not going to solve it overnight. I think it's a long-term process, and education plays into that from all levels. I've had doctors prescribe pain medication when the patient wasn't even asking for it or wasn't complaining of pain, just because they thought that's what they were supposed to do. So it's an education from physicians, pharmacies, down to our children. Everybody needs to be educated on how this can turn out.
Thank you very much, and we echo that. That was a lot of the dialogue and things we're seeing changing even within the medical schools, and the thought process that everybody doesn't need to be medicated to the point they have zero pain, that there are other pain management tools. So we can only hope that it continues to get better. Last question from my perspective, and this has to do with something that you had stated, Gina. You said on average your salaries for a lot of your employees is $24,000. My quick backyard math here puts that at about $11.50 an hour,
Yes.
which is not a lot of money to survive on. I don't know if you know the number of instances and where Narcan has had to been instituted through your Commonwealth, but my understanding on average it's running $800-900 to $1,000 a hit. I suspect it's probably in the hundreds, probably 500 could even be a low guess. If we're doing that 500 times a year, that's $500,000 that could be better utilized for probably to hire and pay staff better. It's just some numbers I think people need to throw around their head and think about, and I understand everybody wanting to try to assist people, but it is a never-ending solution if we keep doing the same thing over and over. And a lot of our EMS and police services, you know, are frustrated, and they're being challenged on what call to go to when you only have 1 or 2 ambulances, and nobody wants to measure the importance of one life over another. And they shouldn't have to be put in that predicament. I'll close my own comments and turn to Representative Nelson has one quick question, and just personally, I want to thank you as a Commonwealth employee, as a Commonwealth policymaker, because God bless your individuals, your staffs. I'm assuming your staffs are probably 20 or less. But do the math equation just from the numbers I threw out. We could be hiring your staff at a lot better rates and still have somebody left over if we weren't spending it all on Narcan and those types of instances. And that's the kind of stuff I think would be good feedback, and that's the stuff we want to share as a committee to the governor's office and to the Department of Health and other agencies. So personally, thank you very, very much for what you guys do in our community. It is truly for the love of people that you serve, and it is very evident to me and to a lot of us. It's not about the pay, and we are grateful for that. Representative Nelson, I think you have a final question there?
Thank you, Mr. Chairman. My last question is if we can explore a little bit more under the subject of confidentiality, in particular interagency cooperation. You know, we've been working very hard to, the term I've been using is connect the silos, because there's such institutionalization. I don't think we're going to break through any silos, but to begin to try to strategically connect. If we have two offices with two trained professionals that are respective of the importance of confidentiality, it seems like there should be an opportunity if we have a child that may have mental health issues and a parent with addiction issues and an agency that would have tools to get there and a law enforcement that could potentially benefit. Are there ways that we can enhance interagency confidentiality to be able to address what we know are recurring pitfalls, I guess, in the system itself? So we can, if you're trained and you're trained and you each have information that would be helpful, how can we connect you in a better way?
From my perspective, and again, my rules are much less restrictive than hers, but I can't acknowledge that I know a person without that person consenting to me relinquishing that information to you. So if I have a mom that I want to connect with drug and alcohol, unless she allows me to make that referral and puts it in writing, I can't do that. And that is one of the struggles, again, because you've got so much denial and people are afraid of that stigma, they're often not willing to sign that release.
And that goes both ways. Even when we are treating somebody, to refer somebody to children and youth or talk to children and youth, because of that aspect of their life, there is a lot of denial and fear as to what's going to be said, and are we as drug and alcohol going to say something that may make children and youth do something like take their children away permanently or cause them even more anxiety. That's the fear of the person, of the patient, of the client, as to exactly what is being said, even though our intention is honorable for the benefit of that client, the client's understanding may not be at that same level.
Thank you very, very much. Great questions, Eric. And to the ladies, we can't thank you enough for your time, your service, and your commitment to what you do. Do not let today's dialogue be the end of the conversation. If you have something that comes up later, I know Representative Dowling, Walsh, and Werner, a lot of your more local representatives are very, very interested in this issue. They want to hear, and you can always contact us through the policy committee. We're grateful. Thank you very much.
Thank you.
For those that are joining us on the audio-only rebroadcast of today's hearing, I just want to let you know what you're listening to. This is the House Majority Policy Committee hearing on the opioid epidemic and how it affects children and youth. I would call everyone's attention to the packet that should have been on your chair. If you didn't receive one, we may have some extras on your way out. Make sure you take one with you. Everyone who is offering testimony today has given us a written transcript and many times has much more detail, including perhaps statistics and graphs, that they were unable to go into during their testimony today. So I know many of you in the room are service providers of some sort or have some vested interest in drug and alcohol prevention or the opioid epidemic, I would encourage you to take this home as some leisurely reading. For those of you who aren't here with us in person, you can find a full PDF. It's a few hundred pages of all of the testimony available at www.repdowling.com. Also in that packet is testimony from James Stark, the CEO of Fayette County Community Action Agencies. Jim was unable to be with us today. He looked at this problem and epidemic from a little bit of a different perspective, where he's not in any type of substance abuse, but does assist individuals with aid and help. And he has testimony that he's submitted for the record, as well as all of the places that he's backed up that testimony. So I'd encourage you to make sure you seek out Jim Stark's testimony as well, even though he's unable to offer it to us orally today. Our final panel of the afternoon will include Leslie Greenfeld, Southwestern PA Area Agency on Aging, Dr. Paul Nimenick of the Catholic Charities of the Diocese of Greensburg, and Mary Sampe, who is a resident here in the county and is employed by the Connellsville Catholic Churches. We will start with testimony by Leslie, and we'll proceed through Paul and Mary, and we'll take questions at the end. Thank you.
Good afternoon. It's my pleasure to be here today.
I apologize, Leslie. Is your green light on?
It is.
They can't hear you at home if it's not. I apologize. Thank you.
Thank you so much. Yes. Good afternoon, distinguished members of the House of Representatives Policy Committee. It's my pleasure to be here today. And what I think you're going to find from my testimony is this is a multifaceted, multi-generational issue that we're experiencing here today. So my name is Leslie Grenfell. I am the Executive Director of Southwestern Pennsylvania Area Agency on Aging, and we are a private nonprofit area agency on aging serving Fayette, Greene, and Washington counties. Today my testimony is focused on the role that grandparents or other relatives play in providing a safe, and I want to repeat this, I want a safe and stable home environment for the children whose parents are unable to care for their children because of the opioid epidemic. Our area agency on aging is one of 52 in the Commonwealth of Pennsylvania that receives funding through the Department of Aging, and we provide a wide range of home and community-based services. However, my testimony today is really focusing on one particular program, and that is the grandparenting program. Under the Federal Older Americans Act that was revised in 2006, there has been a change to the National Caregiving Program, which permits 10% of the federal funding to be used to support grandparents or other relatives that are caring for children who are 18 years of age or younger and living in the same household. And it provides a wide range of services and supports. The federal funding flows through the Department of Aging to local area agencies on aging for ongoing expenses and provides, on average, a total of $200 a month for support and a one-time grant of no more than $2,000. As a consequence of the opioid crisis, our program has witnessed a dramatic increase in the number of grandparents who are in need of various services and supports, who are caring for their grandchildren, most often because the children are incarcerated or are unable or unwilling to care for their children because of the use of opioids. Currently, the services that are provided through our program, 70% of the grandfamilies have a direct attribution to the opioid epidemic in southwestern Pennsylvania. Now, I'd like to take a few minutes just to talk with you about exactly what we're experiencing by giving you a particular case example of a grand family. And we call them either grandparents or grandfamilies because, as was mentioned in the earlier testimony, this could very well be an aunt or an uncle or some other member of the family that rises to the occasion of providing support in these particular families. So permit me the opportunity to describe a situation that is very typical. We have one 77-year-old grandmother who receives a call in the middle of the night, and this is very typical. It's always in the middle of the night, that her daughter was incarcerated due to a drug-related assault and theft charges. The grandmother was asked if she would take her grandchildren. As often is the case, there's really no one to care for them. Wanting to ensure that her grandsons, now there's 3, age 11, age 9, and age 3, had a safe home environment, the grandmother agreed. Then we have what's so typical in these type of cases. In the pursuit of money needed to purchase drugs for the addiction, her daughter stole the family's only vehicle, wrecked it, leaving the family without any kind of transportation. Medical appointments, grocery shopping, any type of school activities that was mentioned earlier as how very important it is to provide the stability that the family needs in this crisis. This is just one of the programs that is available, but I think it's important to state in this particular situation, the Area Agency on Aging is able to provide ongoing monthly support for families who are often in financial situations that was mentioned earlier that do not have the funding to be able to support respite and childcare. Also, in this particular family, they needed a one-time grant so that there could be a play area for the family's children on a busy highway so that they had an opportunity to be able to play in a safe environment. What I wanted to mention to the distinguished committee today is this is just one of very many situations that we find where grandparents have stepped up to the challenge of raising children with little or no real financial support. Research has shown, and we have substantiated the fact through speaking with grandparents and other relatives, they actually have a very protective role that helps to mitigate the trauma as well as the abandonment that many of the children experience. I think this one comment by a 3-year-old might sum it up. He was very upset, as the grandmother explained to us, because neither one of his parents, both who are addicted, were unable to attend his birthday party. His comment was, my parents have chosen to have drugs over me. And that is the profound sense of abandonment that these children experience. And that relates very clearly to what the earlier panel was saying. There is a profound effect on children who are experiencing this trauma. Now, through the program and through support groups that we offer, families are provided with technical assistance and supports on rights and benefits, and the support groups that are provided bring the family members together so that they're able to understand that they themselves are not the only ones that are experiencing these difficulties. And do provide, I think, in the long term, another way to support the reasons for helping people in recovery, for families that can be unified and reunited at a later time. But I'd be very remiss if I did not say, it's very important to know that grandparents or experienced or other relatives actually face many complex barriers in caring for their grandchildren, especially if they are unable and need more assistance in navigating legal custody, as well as maybe if I may, the children and youth system as well. What we find is that they are very unprepared. They receive these calls, and they do not have the experience or necessarily the expertise they need to be able to ensure that they have the entire support system that they might need to make the impact in the children's life that are needed. Grand families, as we oftentimes refer to them, also feel sometimes that they are very isolated. Where you have many retired individuals who are potentially involved in volunteer activities or maybe some kind of more travel opportunities that are available to them, these grand families find themselves helping children with homework or changing diapers. So this is very isolating to them, which is why I think that our program and many others, including, I'm sure, the faith-based organizational programs, really provide that needed support to be able, these are unsung heroes, if I may. These are individuals that have stepped up, saw that there were really no other alternatives, and in some of our cases, and I have several case files here, and in case after case, many of these grand families are taking care of 3 to 4 children. So you can see there's also a financial impact that the family would be experiencing that they had never planned for and never anticipated, quite honestly, having a need for. In summary, the grandparent program, in our opinion, offers a safe haven for the grand families. And they have an opportunity through the program to share the common bond, as I mentioned earlier, because they're all experiencing the same issue as it relates to, they're actually victims in the opioid crisis, without a doubt. As a result, these grandparents truly have a great need for and are receptive to receiving the services provided by the Aging Network because it's non-judgmental. And it does include the support groups that I mentioned earlier that are specifically designed to help relieve the caregiver stress. Although the burden of the opioid crisis on future generations cannot really be fully measured, I think it's important that we state that as the grandparents are confronting all of these challenges, I think we have an obligation to support them in any possible way that we can. Though there is, I said, federal funding that comes to states to help support this program, the point I'd like to leave you with is that this is a crisis which has escalated to the point where most of the families that we are serving right now are in the position of having some type of drug addiction, be it heroin or opioid, or any other type of prescription drug addiction as well, which has caused the family to disintegrate. And Representative Dowling, I want to mention that in your opening comments, you mentioned that this is an interagency, intercollaborative, state and federal issue, and I couldn't agree more, because as you can see, the issues that we're all facing really are of a magnitude where it's going to require all of us, including all of the agencies, to be taking resources and collaboratively working to ensure that there is a community intervention and not just one. Thank you for the opportunity to bring grandparents and grandfamilies to the attention of this committee. Thank you.
Thank you very much, Mr. Chairman, Representative Dowling, for the invitation to speak before this committee on the effects of opioid addiction on children and families. My name is Paul Nemec. I am the Director of Counseling Services for Catholic Charities of the Diocese of Greensburg. The Diocese of Greensburg encompasses 4 counties in southwestern Pennsylvania: Fayette, Westmoreland, Armstrong, and Indiana counties. The number of deaths that we have experienced in those counties, in the Diocese of Greensburg, is staggering. In 2016, in those 4 counties, there were 319 deaths due to opioid overdose. In 2017, as of yesterday, In 2017, the four-county figure stands at 331. 64 of those deaths are from Fayette County. 193 of those deaths are from Westmoreland County. It's hard to wrap your head around those numbers, especially whenever you think that most of those deaths, if not all of them, were preventable. They did not need to happen. Every day as a result of this epidemic, children are losing parents and parents are losing children and whole families are being disrupted. And in some instances, families are being destroyed. Families are being torn apart by this issue. The Catholic Church and other religious communities of faith is committed to standing side by side with families in recovery, with individuals in recovery, and with all those currently suffering from the disease of addiction, as well as those families grieving the death of a loved one due to an opioid overdose. On June 29th, 2017, Bishop Edward C. Malesic of the Diocese of Greensburg issued a call to action about this very issue through his pastoral letter entitled From Death and Despair to Life and Hope, which is available on the Greensburg Diocesan website. Accompanying the letter's publication and distribution, the Diocese of Greensburg coordinated and conducted a series of prayer and education sessions during the summer of 2017. These gatherings were open to anyone who wanted to attend, regardless of their religious affiliation. Representative Dowling participated in one of the sessions that we had here, as did the county commissioners and other elected and appointed officials. Two of these sessions were held in Fayette County, one in Connellsville and one in Uniontown. All 7 sessions, however, across the 4 counties of the diocese were exceptionally well attended. Attendance varied from about 125 or 30 people or so to over 250. This was extensive. All 7 sessions were also included education about addiction in general, about the current opioid crisis in particular. They included personal testimony from participants, and they included public prayer. In summary, in brief summary, allow me to mention some of the things that we heard across the diocese this summer. As has been mentioned in some earlier testimony, and as we undoubtedly all know, addiction to opioids is indiscriminate. It kills regardless of age, class, race, or income level. It affects individuals, it affects families, it affects communities. It's often insidious. It can often begin following the legitimate prescription of painkillers for someone's injury or surgery. Most of those who spoke at our gatherings had family members or close associates who were either in recovery or who were currently addicted or who had died from an addiction-related circumstance. Secondly, parents of children and young adults who died from an overdose often experienced the blame and the embarrassment and the shame from other people, the judgment for, quote, for not loving their children enough, or for not doing enough to reverse the addiction. Thirdly, people in recovery spoke about their struggles to stay in recovery, as well as the inadequacies of the treatment systems available. Families spoke about the frustrations of seeing loved ones continue to struggle, often with little or no hope or knowledge of how to really assist them in any meaningful way. Wage earners who were prescribed opioids to deal with work-related injuries, they were often caught in a war between possible addiction to the opioids and the real and pressing needs to provide a living for themselves and their families. Grandparents spoke of having to raise their grandchildren because their children, the grandchildren's parents, were unavailable due to their own addiction. These same grandparents often try to cope with the same blame and shame and the stigma of having an addicted person in the family and yet not knowing what to do about it. almost every individual to a person described his or her life as being forever changed. This often was directly related to the death of a loved one or to the constant struggle to support a family member in recovery, not to mention the anxiety related to their uncertainty about the future. A number of significant obstacles impede a healthy and productive and helpful response to this crisis and continue to endanger children and families and communities. We could talk about obstacles here all day, but the one obstacle that came up again and again and again across the diocese had to do with the stigma associated with addiction, the negative judgment, the blame, the shame. We heard from so many people who are either addicted themselves or are in recovery, or their children and families, that they all across the board suffer from this. It's the elephant in the room, really, that needs to be addressed if we are to treat this problem as what it truly is. It's a disease that is not chosen or welcomed, but one that quietly sneaks into one's life and changes it forever, and usually unexpectedly. The stigma associated with addiction is based on a lack of fundamental knowledge about addiction itself. Let me be clear about this. Our position is that addiction is a disease. It is a preventable disease. It is a treatable disease. People can recover and do recover from this disease. Families recover from this disease. But recovery, as we all know, becomes a lifelong process. It needs support. It needs support from the community. It needs support from the churches. It needs support from the legislators. It needs support from families. Recovery also is rarely ever a straight line process. Relapse is most always part of recovery. It's important to recognize that. Recovery is a lifelong process, but when the disease of addiction is treated as a choice that one freely makes, rather than as a disease, then the often not so subtle judgment is that the individual, and by extension his or her family, is a moral failure. They are not strong enough. They aren't loved enough. They're not smart enough to be able to avoid opioids. The faith-based community has gotten some support recently from some research that is indicating the importance of religious faith in recovery. Of the people, there's a study out there that's being conducted right now that indicates that of people in recovery who spoke with a religious personage of some kind, a priest, a minister, a rabbi, some member of a faith community, religious community, of the persons in recovery who spoke to someone like that, 95% of them, 95%, said that doing so was an important first step in their recovery. The churches have a role to play. Our takeaway in conclusion as a church is that we see our role in this battle as one of providing prayer, of providing education about the disease of addiction, and about providing ongoing local support and companionship for individuals, families, and children as they face the changes introduced to their lives by this horrible epidemic. Thank you for this opportunity to speak with you this afternoon. Thank you very much.
Thank you so much for having me and inviting me. I want to thank Representative Matthew Dowling. We grew up together in the same neighborhood, so I know what I'm about to say is personal to him too, so I appreciate him being here and doing this. My name is Mary Sampe, and I'm the Director of Evangelization for the Connellsville Catholic Community, and that is 3 parishes, St. Rita of Cascia, St. John the Evangelist, and Immaculate Conception. My passion, along with Dr. Paul Nemec, I work with him through the Diocese of Greensburg, that's the diocese that I am a part of, is to create vibrant faith communities that will go out into the world and serve our broader community. This is not a cover for conversion. This is basically just to be there and to support our local communities. Recently, I have been working with Paul and with the Drug Advisory Board, as well as trying to reach out to Fayette Drug and Alcohol, CYS, and Highlands Hospital in order to raise awareness of the epidemic. I am also part of something called the Stand Up and Choose Tour, which is an anti-bullying, anti-drug, life-affirming presentation that has been to most of our area middle schools, including Connellsville, Laura Highlands, Albert Gallatin, Mount Pleasant, Elizabeth Forward, and in May we're going to be going to Uniontown. Our churches have also collaborated with parishioners and counseling services in order to provide Nar-Anon, which is a 12-step recovery-based program for the family and friends of addicts, as well as grief support for those who have lost a loved one due to an addiction. These are not religious programs, they're spiritual programs, and they're open to the public. Almost every single day, I'm approached by someone in my community who has been impacted by this epidemic, and many times there are children involved. Every day I ask myself, how are we as a church and a community responding to this epidemic? What resources can we make available to our parishes who are working on the front lines? Unfortunately, much of my passion of this specific subject has come from my personal experience. On December 7th, 2016, my sister Angela Marie Phillips died of a drug overdose. She was 34 years old. We grew up right here in Fayette County in an extremely close family. So I think it's important to note that we really have been talking about some of those at-risk behaviors and situations. Well, my situation was not like that. I grew up in a very tight-knit, close family. We all went to Catholic school. We all did very well in school. We were all very close. We all got married. We were all involved in our church. Just an hour before I got here, it occurred to me that I would be coming to the exact same place I had my own wedding reception, where my sister sat where Ryan Warner is today and gave a speech about me at my wedding. And so it's not lost to me the irony of the fact that today I'm in that same space speaking about her to all of you. She got married and had 2 children. About 4 years ago, my sister was having some health issues due to an autoimmune disease called lupus, which my mother as well as I have the same related autoimmune issues. As a result, she was put on prescription pills for her pain, and she became addicted to them. And it was that situation that led her into rehab. While she was in that rehabilitation center, she was introduced to a man that would later introduce her to heroin. And after only a brief couple of months using heroin, she returned to a clean life for about 3 months before dying alone in a hotel room of a fentanyl-laced heroin overdose. On the day of her death, I will tell you that I was very calm because I thought, she can't hurt herself again, and she can't use again. She was truly in a prison of her own mind, and she hated herself so much, and now she didn't have to hate herself for what she had done to us or to her children, and she was at peace. What I want everyone to know is that addiction truly is a disease. Angela did not choose this. No one wakes up in the morning and says, I'm going to be a drug addict today. There are a lot of things that lead up to that decision. Angela might have chosen to use for the first time, but after that, it was not in her control. I also want everyone to know that addiction is a family disease. Even though one person uses, it affects the entire family and is painful beyond belief. On the day that I lost my sister, I also, in a sense, lost my parents, as they are now the legal guardians and primary caregivers of my 2 nieces, who are 8 and 6. I have 3 children of my own, who are 6, 5, and 2. I am no longer considered one of my parents' children, but rather another caregiver, and the only other means of support for my parents, as they try to navigate through this, and we try to raise these two girls whom I love as my own. I cannot begin to express the feelings of isolation, lack of support, and stigma associated with raising two children who have lost someone due to an addiction. I cannot begin to express or put into words the difficulties of the pain associated with trying to grieve someone you love, while at the same time trying to walk a parentless child whom you also love through their own grief. No one should ever have to tell their loved one that they're never going to see their mom again. And that is what we had to do. On this journey of helping to raise my nieces, there have been many questions that they, along with myself, along with my own 3 children, want answers to that I just cannot answer. There have been many times where my nieces say and experience memories that they say, I wish my mom were here. And one thing is for certain, they had a mother, a wonderful mother, and I, nor my own mother, will ever be her. I had to watch almost helplessly as my parents' world was turned completely upside down. They are no longer grandparents. That role has been taken away from them. They are now mom and dad again. And as you were saying, the physical, emotional, and mental effects that this has had on them and our immediate and extended family are immeasurable. On the contrary, I feel incredibly fortunate and blessed that my parents have physical custody of my nieces, and we can thank my sister for that. While she was still alive, she is the primary custodian, joined with my parents, and made sure that they were granted physical and legal custody. Unfortunately, there are countless grandparents and guardians who are raising children as a result of this epidemic who are not so fortunate. From my standpoint, I see a society that wants the grandparents and the caregivers to do the work in the everyday raising of these children, but a legal system that does not support them or give them the rights that they desperately need. The legal system should recognize grandparents as parents in these specific situations. In many cases, grandparents are considered secondary, even when the parent or parents have absolutely no role in the raising of that child. We also need to provide legal liaisons for these grandparents to help them navigate through this and provide the legal support that they need. We also need to consider the fact that these grandparents may or may not have a community or support system. I often wonder, if I was not here with my parents helping, what would happen if something were to happen to my parents? Where would those children go? They may be elderly, or they may be experiencing health issues of their own. And as you talked about, Leslie, they may or may not be receiving financial assistance. And the state will take care of these children into adulthood if we do not give them the help and the resources that they need now. At the same time, I am encouraged by the work that I see being done. I see people who are genuinely want to create change and desire to create change. I see communities coming together. I see the stigma of addiction decreasing, and I see empathy increasing. I will say there are many, many people in my community who have stood behind us and encouraged us to talk about our story. And there is hope. And we share our story so that we can raise awareness and encourage other families to open the dialogue with each other and with the leaders of our community. And together, we can help make decisions that are in the best interest of these children who are truly the victims of this modern epidemic. Thank you very much.
Thank you, all three. Very compelling and powerful testimony. I believe we have questions starting with Congressman Saccone, then Representative Dowling. Any gentleman to my right? Well, we'll start with those two.
Thank you, Mr. Chairman. Thank you all for your testimony and what you do out in our society. I appreciate that. Of course, there is a profound effect whenever a family unit breaks down. And that's why it's so important for us to promote family values, which our culture does not promote right now. I'm a grandparent, and I can tell you that there is nothing I wouldn't do for my 2 grandchildren. Nothing. And I'm sure my wife feels the same way, and I'm sure most of the grandparents in this room feel the same way. So, but what would you say to, my constituents who would say, look, that's a family responsibility. When you have something happens to the parents, the grandparents step in and putting aside legislative remedies like recognizing them as parents, I'm all for that. We could do that. But what about the constituents that would say, look, it's not the taxpayer, it's not the rest of us responsibility to pay for that. It's the family's responsibility to take away when they've had a family crisis, to take responsibility for those actions and step up and do that. It's not for the taxpayers themselves to step up and pay for that necessarily. That's the church's responsibility. That's the family's responsibility. That's we got private what would you say to those constituents that might say that?
In our opinion, it is the program that I'm referring to really does operate on a sliding fee scale. So for those families and grandfamilies that find themselves at the poverty level, and then they have an influx of 3 to 5 additional children, I would submit to you that they do in fact need some financial assistance. So those at the higher end of the economic spectrum would not necessarily be receiving this type of support that I mentioned, but it's still critically important that in my testimony that all of us collaborate together, because we can, as a community, also bring particular expertise to family members who are older because of the work that we do in the community. And the support groups are something that we're already in the process of developing more specifically to deal with this particular crisis because of the amount of people that are affected in that. So I'm not necessarily requesting any additional money. What I see, to your point, Representative, is that it is more of all of us individually as entities working together in a more collaborative fashion to be able to help assist families, individuals that are addicted, the entire population that's affected. That would be my comment. Anyone else?
I think that makes a lot of sense from a certain standpoint. From another standpoint, there are a lot of parishioners that are a lot older than my parents who are raising their grandchildren, and obviously they don't have the financial means and they don't have anyone else in their family to do it. So yes, the responsibility is falling on them, but then how can we provide them support if it's not financially? That has to be a piece of it. Because, a lot of these more elderly, they can't drive, they can't do anything for the people the children that they're not now taking care of. And so realistically, I'm not really sure how they would do it if we did not provide them with some kind of financial support.
If I could add to that, I would agree with you, Representative, that this is it's a family responsibility, but it's also the responsibility of the churches. It's also the responsibility of the communities. We heard testimony earlier about that it takes a village, and it truly does. We heard repeatedly this summer people expressing, as I mentioned earlier, the difficulty of accessing services, of even knowing where to turn. Mm-hmm. People have to have they have to carry it through, but they have to have the support and the direction and the knowledge of what to do, where to go, how to access services. Those kinds of activities are a critical component of this. Otherwise, our experience is that people are hanging out there, despairing with no place to go and nothing to do, no place to turn.
And that's part of what you do, right? You give them
Yes.
that kind of
Yes,
knowledge of where to
Yes.
turn.
That's what-
As
that's-
the churches
Absolutely.
step in, and
Yeah.
we want to promote more of that. That's what that was my point. Okay, thank you. Thank you very much.
You know, first, I guess, maybe an acknowledgement or a statement. Mary, I want to thank you for sharing your story. As she alluded to, we grew up in the same neighborhood with an alley that cars didn't travel between our two homes, and we rode our bikes up and down the street. Her family was a loving, kind family that fed us when we came in through the back door, and in my family, the opposite to them. I think it goes to show, to Jana's point this morning, that there's a stigmatism, and sometimes people don't look for an overdose case to come out of tight families like yours, Mary. And I'm just so happy that you share your story, your tragedy, because it helps us to look and see that the stereotype or stigma that exists is not always the case of the type of families that are affected. So I just thank you for being brave and for sharing that, and I keep you in my prayers as you do that.
Thank you.
I would ask, Paul, now that the Diocese of Greensburg as one faith community has gone through the series of listening sessions that you did, what are your next steps, and how do we engage other nonprofits and faith communities to work with you in taking those next steps to be able to provide the information and services to your constituencies?
Great question, Representative Dowling, and a couple of answers to that, a couple of responses to that. First of all, as I mentioned earlier, the sessions we had this summer were open to everybody, and we had people from other faith traditions there. And they were all asking us, how can we help? How can we work together? We have begun to tap into some of those other organizations, for some of their background, some of their perhaps expertise, and some of their services, frankly, that might be of help to us. The other activity that's actually in the process of being put together right now, even as we speak, takes off from that research finding that I mentioned a little bit earlier about 95% of people in recovery say that talking to a person who a religiously oriented person was helpful in their recovery. We are starting a series of training sessions, again, all around the diocese, in March, actually, that will train our clergy and our parish staffs, our volunteers, any of those folks in the parishes, to be able to recognize addiction, to be able to know what opioids are, to be able to literally to talk to people using the language that is helpful, and educating them on the services that are available in each of the communities all over the diocese. Again, if somebody shows up at the door, if somebody shows up in one of our schools, we want to be able to say, we want to be able to get them in, and we want to be able to say, here's where you need to go, here's what you need to do, let me make this phone call for you, and we're educating people about how to talk with them so that at least the first thing that they get whenever they come to one of our doors is a hand, a helping hand, and frankly, a lack of judgment, a lack of that negative judgment that we've talked about. So that's coming up most immediately. I should also mention that planning is being done in conjunction with, this isn't just our own, this is done in conjunction with agencies in all of the counties, including here in Fayette County, particularly the drug and alcohol community here. So it's a collaborative endeavor at this point.
Representative Warner?
Thank you, Mr. Chairman. I have more of a comment, I guess, I do than a question, but I just want to thank everybody for coming to testify. Mary, your story is extremely powerful, and it, again, as Representative Dowling has alluded, that this is a problem that affects all socioeconomic levels in our state and country. And there are very few people, even people in this room, myself included, that do not have friends and or family that are directly impacted this, and the struggles that go along with not just a person that is impacted, but also the family members, including the grandparents and everybody involved. It is extremely difficult. And in Jan and Gina's testimony earlier, we had touched on faith a little bit. And, recently we had just talked about that 95% of people in recovery, the importance of it, of reaching out to somebody of faith. And, when we look at this issue, we have to look at it from two separate angles, right? There's prevention and recovery, right? We need to stop it from happening, and the people that are there, we need to help them recover. And again, we talked about the importance of having faith for people that are recovering, but I think it's also fair to mention that faith can play an important role from stopping drug addiction in the first place. To people that feel alone, that start using drugs for that reason, to have something, to have belief in something. And I've stated this before in speeches that I've gave, that we've done everything that we can to remove God from our culture, and yet we seem surprised at the consequences. And I heard a very uplifting message last night that in America, we don't worship government, we worship God. And we've had so many discussions and hearings on this issue, and there are so many things the government can't do. Can do to help out this issue, and there are so many things that it can't do. But one thing I think that we fail to mention, and it fails to get brought up enough, is the importance of God and faith in helping solve this problem. And not just this problem, but many of the problems that we face in this country, in a country that was founded under God. And again, I want to thank you for that. And I'm glad that we were able to bring that up, and I just want to thank you. And again, thank you all for your testimony and helping us as we get together as a community, as elected officials and of faith-based organizations to help solve this crisis. Thank you.
Representative Nelson?
Thank you, Mr. Chairman, and thank you all for your testimony. Paul, I very much appreciated the outreach and the initiative, that the diocese took on. And one of the action items that we would encourage for individuals, and when I go and speak to communities for, hey, what can we do or how can we do, I think Representative Saccone touched on the importance of getting young people involved in organizations, like the fire department, and let them go to emergency response and see what an overdose looks like in its most unpleasant throes, or hold a baby who is addicted. Each of us has ways and tools that we could give back. If you could touch on for a moment, I know that was a new initiative, but Catholic Charities is already very active in helping with finding housing and helping the struggles of people who are in it. Can you touch, I know we struggle with, the separation, and as government doesn't want to necessarily endorse any faith-based areas, but there's a lot already happening to be able to support people who are on the road to recovery. And can you touch on not only some of those roadblocks, but some of the ways that your organization is working to help that?
I'd be happy to, Representative. Thank you. We attempt to do as much as we can regarding the issues that you brought up: housing, utility services, that people who have lost utility services or are in danger of losing utility service, in danger of losing their housing. We have a material assistance department at Catholic Charities in Greensburg that does that takes these kinds of calls, and that does a very extensive assessment process. We don't just hand out money. We don't have apartments that we could set somebody up in or anything like that. But we help people to go through, for example, whatever kinds of income support that they have. We help them to develop budgets. We look at we look at not only the assistance that we might be able to give, but where they may be able to leverage assistance from other places in the community. For example, we are in, of course, heating season right now, and people have trouble paying their gas bills or whatever the heating bill is. If people have not applied for LIHEAP, we will work them through the process of applying to LIHEAP for whatever assistance might be available from there. So, we're doing those kinds of things, which are good and which are helpful. I can't give you statistics because that's not my department, but it's there, and it's pretty vibrant. It's ongoing. We get a little bit of funding to do that from the various United Ways, of which we are a part in the 4 dioceses. But most of the funding from that comes just from our own fundraising. And quite frankly, relative to either housing or utility assistance, it kind of depends on how far those limited resources are going to go. Depends on what the weather's like, to be perfectly honest with you. And frankly, we run out of money, in the past because we just don't have it. But the need is there. The need is crushing, and we try to, as I mentioned, leverage from other community sources. We're fairly well connected in all the counties, so we'll try to work what we can. We never pay. I won't say never. We will rarely pay someone's $600 overdue gas bill, but we will give them a portion of it if they qualify. We will give them a portion of it, and we will walk them through the process of getting the other money that they need from whatever other source to be able to get their gas turned back on or to avoid the shutoff, whatever it is. So yeah, we are addressing that, but it's comprehensive, but it's limited.
Before we close out, I wanted to just take a moment to thank our audiovisual crew. These guys follow us all over the states, and they're there before we get there. They're here while we're here, and they're here after we leave, and we'd be lost without them. And they are also getting the message to other legislators who can't be here physically, so many more legislators are listening to this and have the ability, as well as the public. To you in the crowd, I want to say thank you for taking time to be here, to taking time to care. I suspect you're probably juggling things in your own mind at the mass size of the problem this is and wondering what you can do. As we struggle with, I would encourage you to keep these individuals, some of the other providers that spoke today, in prayer, and these families. It's not an easy thing, and your prayers can be very helpful. I look at young people who I've seen give up their own birthday money at 8 or 9 years old to give to Alex's lemonade stand. Maybe look for those types of things. Get the money to these organizations, and they can help somebody out in a different way. I want to also take a moment to thank Representative Dowling and his staff. We are only as good as our staff. You guys done a bang-up job setting us up today. Top to bottom, we are very appreciative. Matt, I'm really proud of you as a younger member of our caucus, stepping up and wanting to take this on full force, and we're honored to be here. And you locally are very, very honored to have a representative like that. I'm going to turn it over to Matt to close it out. And last thing I do want to say, as a little bit of inspiration, at one of our hearings down in York, we had a young lady who testified before us, and she talked about being incarcerated 10 times for her own addiction problem, lost her daughter. And sitting in jail that last time, she was praying and praying, she said, and she just didn't think God was ever listening to her. And it wasn't until the 11th time that she realized that she wasn't taking the time to hear God. And she is now recovered, she has her daughter back, and she is now providing the social services to other people. So don't underestimate the power of prayer.
Thank you, Chairman, and thank you to my colleagues who came out and spent a day, some of them with a great deal of travel, to be here to listen to the problems that are facing Fayette and Somerset counties, my 51st district here. It's important to have these meetings and hearings not only in Harrisburg, but in our rural communities where we can listen to local service providers and take that information back with us. So I thank the chairman for moving this hearing here for us and for my colleagues for attending. A special note of thanks to everyone who offered testimony today. It was uninhibited. Everyone was very open, and that kind of dialogue is the only thing that's going to help us to mitigate any kind of these issues. I also want to thank just quickly the historic Stonehouse Inn who provided space for us today, and their staff was fantastic in setting things up, especially Christine Shaney. You know, this is a extremely heavy topic that we're dealing with. And I wanted to come at this hearing today from the perspective of the child, from the eyes of our youngest constituents. I have a 4-year-old and a 5-year-old, and it really doesn't matter how strong of a legislator I am, how much of any respect you have in the community. Whenever you come home and you see those young eyes look at you, you kind of melt. And I can only imagine what children their age, children that are just as sweet and innocent as they are going through when their parents are afflicted by this horrible, horrible epidemic. You know, what are they thinking? And I was almost brought to tears when Leslie mentioned the little boy that, or child that didn't have their parents at his birthday and realized that his parents chose drugs over them. And it really it breaks your heart. Today can't be the end of our conversation. This was just one facet. I know that we need to continue to break this into manageable sizes. We need to continue to have conversations with our first responders, with our EMS. There's a larger debate to happen about Narcan. That's a constant conversation that we have. And what is the appropriate ways to use that within our community? This can't be the end. And as I said in the opening, we as government, as legislators, can't provide the answers. We can't do it alone. We need the educational society. We need those who are in prevention, those who are helping with recovery. All facets and walks of community life need to be involved in this debate and discussion so that we can come together to lessen these effects. You know, as dark as this is, I was kind of inspired as I was reading through Paul's testimony by Bishop Malisik's title of his recent letter, From Death and Despair to Life and Hope. And through conversations like this, I believe that there is hope that our communities can carry on. And we need to look to those people who are on the front lines fighting this every day. So kind of in closing, I just want to thank those who do anything, any type of professional work to help mitigate this epidemic. They are truly people that our communities are blessed, whether they be in recovery programs and children and youth, first responders and EMS services. They are the heroes that our communities are built on. Leslie's written statement ended or concluded with a quote from Mr. Rogers. And I'm not going to steal that same one, but I remember reading a quote that Mr. Rogers said when he was really upset, when he'd see something that bothered him on television, that his mother would tell him, look at the bad and look for the doers. Look for the people that are helping. And that's where you'll find hope. So to those doers in our communities, kudos and thank you. And thank you all for being with us today.